Like many of my fellow practicing clinicians, I frequently encounter patients who use cannabis for quote-unquote medicinal purposes. I put those quotes there because one of the challenges that I talked about in my presentation today at Psych Congress is that we have an alarming absence of good research about the potential benefits of cannabis. We certainly have a lot of data on the potential adverse effects of cannabis, and that's fairly well known. And part of the problem is, in the absence of good evidence, there is a lot of sort of folk belief that this drug has become kind of a panacea. And I encounter this a lot in my clinical practice, and part of what I do is I try and find better alternatives for my patients who are using cannabis for whether it's insomnia or anxiety, depression, etc. There are certain groups who I'm very wary of using cannabis, particularly younger patients, and by younger I mean under the age of 16. Really, the later somebody can wait until they start using cannabis, generally the better. I also have a greater concern for young women using this. There's been studies that show that young women who start using cannabis on a regular basis are much more likely to develop depression or anxiety disorders later on in their 20s. The group that I have the greatest concern with is any patients who are showing psychotic symptoms when or surrounding their cannabis use. And by this I mean things like paranoia, ideas of reference, auditory hallucinations. These patients are at particularly high risk for exacerbating a psychotic illness with this, but with continued use of this drug. And I'm quite clear with patients who are developing psychotic symptoms or having any kind of psychotic symptoms that this is really a drug that they want to stay away from. I'm also very aware of patients who often will present with depression who are using cannabis. So it's controversial whether or not cannabis causes an avolitional syndrome, this sort of tendency to procrastinate and put things off, not get things done, or if that's better accounted for a pre-existing depression. But whenever I have a patient who presents with depression and cannabis use, I always am sure to treat the depression and think strongly about helping that patient to reduce their cannabis use. So these are the things that I'm thinking about as I'm practicing in my day-to-day office practice, meeting patients who have comorbid cannabis use with their psychiatric conditions. Thanks.